let's talk about some of these advisories on healthcare fraud, Medicare, and healthcare benefits. This one, it's actually pretty broad when you read into what exactly they're talking about. They're talking about, of course, the healthcare fraud that we have been discussing as part of this group, but this one has a few different angles to it. It talks about, unscrupulous medical professionals. And if you don't think this is happening, I can tell you for sure this is happening, where you have medical professionals who are billing Medicaid and Medicare for things that aren't necessary, right? Because just the internal workings of how a medical office bills, unfortunately, doctors and medical professionals and hospital systems are incentivized to submit to rack up as many diagnosis, elements as possible, and they can submit billing for every single visit. And it's really it's almost a game on how you get paid for this particular visit. And unfortunately, there are some hospitals who've figured out that if we can just rack up a litany of things that either are unnecessary or didn't even occur, we can get a bigger paycheck, right? And so that's part of this as well. Now, we did discuss all of the clear fraud that's going on, and this alert does speak to that as well. But just keep in mind, if you remember back in, I believe it was February, we talked about in January, the Department of Justice created this division for national fraud enforcement. And this was it's a centralized prosecution push between various federal programs. We have more overlap than we've really seen before on this particular front. And they're really digging into Medicare, Medicaid, and these healthcare systems. In fact, I think they've used the term crackdown. So this is kind of a furtherance of what was going on in January. So, they're going to be looking into, welfare and public benefit fraud. And so this is going to be a going concern going forward. It's right there. It was in one of their enforcement priorities. And now here we are with this advisory. So this was, it's kind of in furtherance of this whole of government response.